Hey guys, Dr. Dan here with Beacon of Life Chiropractic in Royersford, Pennsylvania. And I want to come to you this morning really quickly and let you know why we see so many people with headaches and what the most common cause is of headaches and how we can help folks. So what you see right here, if you look closely, is the side view of somebody's neck. So if you're looking at me like this and I'm looking this way, you're looking at the side view of the neck. There's the teeth. And here's the thing, is that these bones here in the neck, they should be right along this C-shaped curve, just like a banana or like a shock absorber. And what would happen to a banana, the fruit inside a banana, if you took that banana and you straightened it out? The fruit would come out, right? It would stretch it, it would pop. So here's the thing, what we take care of as principled chiropractors is not the bones, it's not the discs, it's what those bones and those discs protect. It's what they protect, which is literally your lifeline. So what I mean by that is that we're doctors of the nervous system. That's made up of your brain that sits up here in your skull, sends your brain stem down through the top bone of the neck, turns into your spinal cord, and then the nerves come out. And they go to literally every single organ and tissue and cell and muscle in your body, telling your heart to beat, food to digest, lungs to breathe, thyroid gland to do its job, and you don't even have to think about it. But with headaches, here's the thing, is that the top part of the neck right here, number one, that's where your brain stem sits. Number two, there's nerves that go to the head and the sinuses from the top of the neck and the cranial nerve area up here by the base of the skull. And what we see in 9 people out of 10, compared to 1980, it was 2 out of 10. Today, in 2018, it's 9 people out of 10. That curve, that banana C-shaped shock absorber from the side is not there. It's either straight or it's in the reverse direction. So again, I got my rubber band here for you. I want to show you what that means. You have your spinal cord, and when you have the curve, your spinal cord is loose and relaxed like this rubber band at rest. When you don't have that proper curve in the neck, spinal cord stretched. And it's not just stretched for 5 or 10 minutes a day, it's stretched all the time. 24 hours a day, 365, if you don't have the curve in the neck. Imagine the tension that that's putting right at your brainstem area and all those nerves going to the head and the sinuses and the cranial nerves. Do you think that that can cause some pressure on the nerves? And do you think that that could lead to an end result symptom of a headache or a migraine? All the time. I'm telling you, people with 28 days out of the month that have headaches, people 4 to 5 days a week with migraine headaches, to completely gone, or to 1 or 2 a month, and they're less severe when they have them. Because when you get to the cause of the problem, the end result symptom takes care of itself. It will resolve if you get to the cause of the problem. People don't have headaches or migraines 28 days a month because they didn't take enough Excedrin or enough Aleve. Do you follow me? There's always a cause to the issue. So what we say here, my wife and I, Dr. Megan and myself, we say to see is to know and not to see is to guess. So we measure for the function of these nerves, the function of the muscles, and the structure of the spine. So when you look and you see your x-rays, you see your assessments, you know what's going on there. Here's the last thing I want to tell you. This bad boy right here, that's a 10-pound shot put. This, your noggin up here, is roughly 10 to 12 pounds on average. Shock absorber, nice and easy. Curve in the neck, just like this curve in my wrist, I can hold that 10 pounds, no problem. You start to bring that weight forward and imagine how tight these muscles are going to get and how hard. It's kind of hard right there, so I'm going to stop doing that. But imagine with that shock absorber not there, all the muscles, how hard they have to work. Tension, doc, I carry my stress in my shoulders and my neck. When I'm stressed, this is where I feel it. Those nerves, they run down to the hands and the fingers, numbness and tingling. But absolutely, tension headaches, these suboccipital muscles back here, extremely tight and taut, again leading to headaches. So again, doctor means teacher. Dr. Dan here with Beacon of Life Chiropractic. I encourage you to tag your friends in this video, tag your family members, your loved ones, share this video with them, because again, there's too many people who are resorting to just learning to live with it, dealing with it, taking medications, never getting to the root of the symptom, the root cause of the problem, and we want to be able to help them. We believe that our bodies were created properly, perfectly, and they're supposed to work correctly. And when you have no curve in the neck, it's not just headaches and migraines, it's not just numbness and tingling. Again, the symptoms can go on and on from there, but again, to see is to know and not to see is to guess. So we encourage you, we invite you into our practice. Come and get assessed. Mention this Facebook video here that you're watching, or on YouTube if you're watching this video. Mention it when you call the practice or when you send an email to request an appointment, and we'll do your consultation and your nerve and muscle assessment at a discounted rate so that you can see what's going on. Then what you can do is at that point you can make more informed decisions about your health instead of just wondering or making decisions out of fear or frustration. Again, Dr. Dan here with Beacon of Life Chiropractic. We look forward to seeing you soon. God bless.